chairman of the National Governors Association and the Council of State Governments. He was a pioneer in collaborative environmental management and, of course, a former administrator of the Environmental Protection Agency. As Secretary of HHS, he's been an instrumental driver in setting the agenda for establishing secure electronic health records and a standard-driven IT system long overdue for our healthcare system. Value-driven healthcare and the development of transparent cost and quality information for consumers. Access to healthcare for all Americans, a safe food and drug supply chain, and of course health diplomacy across the globe. But today we're here to learn more about the Secretary's recent visit, an exciting trip to India. Mr. Secretary, thank you for joining us. As he's always done, the Secretary had an aggressive schedule visiting a number of companies and industry associations in Chennai, Cochin, Delhi, Hyderabad, strengthening our U.S.-India partnerships.
In the halls of HHS, as indicated, he was Chief of Staff to my predecessor, and his reputation has lingered long, and great affection is felt for him. So I'm very pleased that he would be here today to introduce me. Many of you have spent years, or for that matter, many trips to India, so I don't intend today to come to enlighten you specifically on India, but I do want to give you some of my impressions and how important it was to me as a policymaker to be able to form relationships and also make the observations of some important missions at my department. My primary mission in going to India was to discuss the safety of food and drugs and consumer products with members of the Indian government and the private sector. So I think today is a very good opportunity for me to share a little bit of what I learned with you. It was my first trip to India. I found the country to be a remarkable, vibrant, and entrepreneurial place. Over the course of time, I've had many friends, both in government as well as industry, who are Indian by background. And being there and being able to walk through neighborhoods and talk to people gave me a much different view of them. And it was a very important thing to my relationship with them. And that's just a good way for me to remember the trip. I was looking at it the other day and reminding myself of a moment on the trip where we went off into some neighborhoods to help immunize children for polio. In fact, there's a picture that I brought back with me of me holding a small Indian child and immunizing them with the vaccine, with the drops in their mouth. There's just something about being that close to people and seeing their homes and talking with mothers and holding their children that begins to give you a real sense of who they are and the kinship that we feel with them despite the fact that we live a long ways away. Before I left, I consulted with the Indian ambassador to the United States, and he made a comment that I found true. He said, everything you've heard of India is true, someplace. He told me about all the different languages and the cultures and the disparities between urban and rural, which I saw for myself. I was particularly struck by the density of the population and the unique challenges that provides. You all know that it's about a third of the size of the United States, and I was struck by the fact that it has 4 times the population. The statistic that you mentioned about the youth and the vibrancy of the population, 15% of the entire world's population, 2.4% of the land mass. I think that tells part of the story. The number of small villages and the communities that we were driving on our way in, a world that has to change, and we all have to adapt. I come from an agricultural background. 50 years ago, my grandfather and his neighbors farmed some land that surrounded it, and the composite of that supported 21 families. His generation began to die, and my generation began to buy up his farm and others around it. And now there are fewer than 3 full-time workers that now farm that area that used to support 21 different families. As a result, my grandfather's descendants have been able to seek education, they've been able to earn a living, and they become productive in different ways. I see that same kind of thing beginning to happen in India, but I can also recognize how powerful a force it is and how difficult it is to do it with the kind of population that they...
Might get started, or even negotiations might get started. I'm sorry.
Well, we raised the issue with various ministries of the government. I have begun to have conversations in the U.S. I've mentioned it, and the FDA is now in the process. I indicated that this is part of a larger strategy where we're going to be putting people into various regions of the world. We've announced China today. It's very clear to me that a high priority needs to be India. These don't happen overnight. I expect that we're talking about I'm not going to put a time frame on it, but it needs to happen fairly soon in my judgment. It should be a high priority.
All right, and secondly, another question is, was there any other further commitments or other sort of topics that what you began conversations on during your visit?
Well, there were many. I'll mention just one other. We met with the Ministry of Science and Technology, and we have a mutual and shared interest in the area of personalized medicine. It's clear to me that India, while focused primarily on the generic space right now, they're not a long ways away from beginning to get into the innovation space on new molecules. And we need mutually to be looking, as other countries are, on how we can streamline our regulatory process. Rather than going through just the clinical trials, we need to be able to find biomarkers and other means of being able to test safety and efficacy of drugs more rapidly. India is interested in the same thing, so we're looking...
From India brought Asia today. First of all, is your mind changed after my question at the White House last time that if India is a major problem as far as safety food processing coming from India into this country, or after your visit to India? Second, have you had any conversation with the Indian government as far as the healthcare problems in India is concerned? If you have reached any agreement or ready to do business with India on this matter? And third, finally, what do you think the Indian American community in America and the USIP can do to solve all these problems that we are talking about today?
Well, let me deal with the second one first. I did have conversations with various parts of the government, mostly just exchanging notes on our mutual quest to provide health care to our citizens. I spoke with the governor of one of the prominent states who was in the midst of trying to put together a system of health insurance. It was very basic. We talked about the struggles they have in financing it, the same struggles we have. So we exchanged notes. We did talk at length about the various parties about the medical tourism and the impact that's having on the healthcare sector
and begin with a statement that he made when he was asked to do the same for an unnamed ambassador. You got a better deal because I'm better looking than him. Well, I would like to thank Secretary Leavitt not just for giving us his valuable time and sharing his thoughts with us, but for visiting India, for taking 5 days out of his busy schedule to visit India, to drive home the point that health is a key area of cooperation between the two countries. We are talking today about the whole swath, whole multitude of areas that India-US cooperation is covering. But to me personally, as a woman, as a mother, health is one of the key areas, and we have made huge strides in this area, and US-India cooperation, particularly in generation of vaccines, has helped not just India and the US, but the whole world. And Indian government obviously attaches a huge importance to this area. In the last budget, the allocation to this has been tripled, allocation to the health sector has been tripled, and I really look forward to the collaboration with your department, sir, increasing over time to make sure that we use this increased allocation to the best use and the best benefit of our people. Secretary obviously means business.